Hey everyone, it's Jackson here. It's July 13th. Now 13 days post-op top surgery with Dr. McLean in Mississauga, Ontario, and it's it's great. um, I wasn't nervous going into it at all. Literally, the only thing that I was nervous about before going into surgery was staying with my girlfriend's parents for 2 weeks without her being here. That was it. I've only met them one other time, so I think everybody can relate to that. You're kind of nervous around the mom and dad. So, yeah, the other time that I met them, it was just like over dinner, and then I left, type of deal. That stupid bird's back. So anywho, but yeah, so that was the only thing I was nervous about going into the surgery. The surgery itself went great. We showed up. I had to be there for 9 o'clock in the morning. So then it started at 10, like, that's when I went in. So me and my girlfriend, we got there, went in. What did we do first? I had to put the gown thing on. She gave me uh, like a pill there, so I don't, when I wake up, I'm not like throwing up and stuff. It's like to settle your stomach. And then they hooked up the IV. They put in an antibiotic thing through the IV. Dr. McLean came in. He started doing like the drawings or whatever, and then the anesthesia guy come in. He talked to me for a second. Then the other nurse came in, talked to me for a second, and then it was on. So we go in there, and I see the table. I get up on it. Um, when I lay down, well, they gotta put like straps on your arms and your stomach so you don't move during surgery and all that stuff. And she was like, I'm not scared of that stuff. Like, I'm not, like, I know, like, I went in there and I knew exactly what was gonna happen. Like, just from common sense, basically. You go in, they strap you down, type of deal. Don't panic, you know what's gonna happen. I wasn't nervous about any of that. Hold on a second. I was just seeing if there was a customer here. I'm looking after the shop while they're out. So anywho, she's like telling me, we're just doing this for your own safety type of deal and stuff like that. I'm like, I know, I got it. I'm not nervous about any of this. I'm just waiting for it to get over. The next thing you know, we're talking about where I'm from, down in New Brunswick. And I went to go say something to him about my stepson, and I was out. Woke up shivering cold. It was so cold in there. I couldn't pee for the longest time. It took forever. I was all loopy. Girlfriend showed up because it was like 2 hours. I think the surgery itself was 2 hours, and then I have to stay there another hour till I'm good to go and I can stand and walk and do all that. And yeah, they wheel me down. I get in the van. We come home. I took 2 of the painkillers they gave me, which are really shitty on drugs. Like, I can't take medications and stuff. I get all messed up. So I took those 2, and they said I went completely white. I had to lay down in a chair. So the first day I was all out of it. The second day, there's still a lot of pain. Still couldn't do a lot of things. Third day, my girlfriend was leaving. She left July 3rd. No, 2nd. Yeah. No, the 3rd. Something like that. Because they had to go back, and the young fella had school, and she had to work for another 2 weeks. But then she's gonna be here this Friday. They both are. We're going to Sable Beach for the family vacation. So yeah, for the first bit, I couldn't do anything. I couldn't, like, get in the bathtub because, like, you use a lot of your chest muscle, and more than I actually thought I needed them for. So I couldn't get dressed. couldn't wash my own hair. Like after she left, her mother helped me wash my hair underneath the sink. Now it's all good. Now I got lots of motion. The scars are healing up. Like they're all thin incision line, which is great. So it's gonna heal perfect. They did something different with my nipples. They did the double graft, but they didn't sew them on. They put them there, put the sponge, taped it all real good, and it all naturally just like reattached itself. So that was great, and those are healing good. There's a little bit of scab left on, not much. And I have a lot of feeling, which is, I mean, it's not uncommon, it happens, but some cases it doesn't. Like over here on the side, I have feeling all over. Like I can feel it just like I would touch anywhere else. And my nipples, I can feel them. It's not a full sensation, but there's enough there that I can feel where I'm touching. I can feel yeah. So it's hard to explain, but I can feel things. So that's all good. Everything's healing great. I did go swimming yesterday to check it out. For the first bit, you can't go swimming until the scabs come off and everything, but it's pretty good water. I'm not going to get any infections or anything, so it's good. I'm just really trying to heal it up, because when my young fella gets here, he's going to want to go playing and swimming. He's 4, so I mean, when he left, I could barely give him a hug because it hurt. So now I'm pretty confident I could pick him up. So I'm really excited for them to get here. It's been a rough 2 weeks without them, but you know, we're making do, and everything's healing great. I'm really, like, just to look in the mirror and just see, like, it's me. I see me. My sister was even saying, I sent her a couple pictures. She goes, "It's you now. It's just who you are now." It's like she can see me like I see me. You know, it's great. So I'm really happy with it all. I can't wait to get back into working out. I'm not a person that can sit around for a long period of time and do nothing. So for sitting here for 2 weeks, and it's going to be a few more, I can't work, I can't mow the grass, I can't do anything that I would normally do, but I've been trying. So that's the biggest part. Just that. I feel really lazy, so I don't like that. But everything else has been going great. It's healing good, and I know it's all for a good purpose. Me being lazy, I'm not just being lazy because I want to be. But yeah, if you have any questions regarding anything, if you want to see the pictures so far, check out my Instagram. And that's all I have for that. Leave a comment, hit like if you like the video. If you want to see, like if you want to know anything direct, just shoot me a message type of deal. Yeah, so I hope everybody's having a good summer. I'll try to update everybody. I'm 3 weeks shy of being 1 year on T, so I will just be getting back to New Brunswick. I don't know if I'm going to be making an update video for that. So, but I might, you know, if I have time. I might have some downtime before I go back into work. Yeah, that's it. Hope everybody's doing good. And, yeah, just, if you're going in for surgery soon, have somebody there that can literally do everything for you and is fully comfortable in that. Don't try to stay alone. Don't think you're going to be able to do anything alone, because you literally can't do anything alone. Yeah, even using the bathroom alone was hard enough. So, take care, and we'll be seeing you.